Hey y'all, what it is? Okay, so I'm drinking me some coffee and I realized, y'all, that I forgot to give you guys a formal update. So, without further ado, let me update y'all on what the hell done happened to me and what my doctor told me I have. So basically, a few days ago, I told you guys to pray for your girl because I was having a lot of back issues, a lot of neck issues, a lot of hip issues that I didn't know what was wrong. Like, you guys know that I fell at a restaurant like way back in 2018 and I landed flat on my neck and my back area, right? And I sued the restaurant, all that, and I saw a chiropractor for a few months and I thought I was healed, but no. I'm still having the pain. This stuff happened back November 2018, and I'm still having back pain and neck pain. So I decided to go to my primary care doctor and actually talk to her about why the hell I'm having back and neck pain, why I'm having back spasms, and why I'm hurting so bad. I'm 25 and I feel like I'm 50. Basically, I go to the doctor. She's like, okay, I'm going to test you for lupus. I'm going to test you for arthritis. I'm going to test you for all these autoimmune diseases because it runs in your family and you definitely have no symptoms. Because you guys, I have inflammation in my back. I have inflammation in my neck. A lot of times I come on here and I look swollen, and that's because I have inflammation all over my body, basically. And all over my body hurts. It basically feels like I'm getting punched all the daggum time. It basically feels like I'm sore from getting punched and beat up all the time. And I have not been beat up, okay? So basically, I see my doctor Monday morning. She takes my blood and she also does a tender point test. And she's like, this is a test for fibromyalgia because if you have fibromyalgia, you're going to have pain in these areas. She touches all over the back of my neck. She touches over my shoulder blade and my mid back and my hip area. And all those spots hurt like hell. I was about to cuss her out because she done touch all of my neck and I'm like, ah! And my mom's sitting there like, oh, holding my hand. It was bad. Okay, it was really bad. She touched all those areas. She's like, yep. If you don't have arthritis, if you don't have lupus, you definitely have fibromyalgia. Okay, what y'all saying? I thought I missed one of y'all's. Hey, I was wondering, boo. Yeah, so basically, she takes my blood, and she's like, I'm going to call you back in about, a day or two, and I'll tell you what's up. So she calls me Tuesday morning, you guys, and she's like, good news. I have good news and bad news. You don't have arthritis, you don't have lupus, you don't have anything wrong with your kidneys or your liver function, but you definitely do have fibromyalgia. And the thing that we're going to do for you is put you into physical therapy for a month. All of next month, you're going to have to be in physical therapy. You're going to have to see a physical therapist at the hospital 3 times a week. So basically, they're going to get your back strong enough so maybe you can work out in the future. But don't go to the gym. Don't go to your chiropractor. Don't go to your massage therapist right now because your back needs to heal. And you need to go to a physical therapist. And you're going to be put on these muscle relaxers and pain pills for the next month. We'll see how you do. And if that's still not enough, we're going to up your medication dosage. And you're going to have to see a physical therapist for much longer. So basically, you guys, I have fibromyalgia, and it's a disease that basically attacks your muscles and your neck area, your back area, and your hip area, and it makes your muscles all tensed up like a big freaking stress ball in your body, and it makes everything sore or sometimes tingly or sometimes like a stabbing pain. Sometimes I wake up, you guys, and I feel like I done got beat up in the middle of the night, and not in the sexy way, bish. The like I got beat up in the middle of the night. Somebody that came in my room and done punched me in the neck or something. That's how I feel a lot of the time when I wake up. I'm all sore and I'm all stiff. And basically that's what it is. I have fibromyalgia, and it's a disease that mainly happens with women who have had car accidents, who've had injuries back to back, which I've had, and women who's had emotional distress, which I have. And basically it just makes your muscles all super tight. It makes it hard for you to work out. It makes it hard for you to get around day-to-day stuff. You may have like back spasms. You may limp. You may have lumps in your back and your neck area, and it's a disease that just attacks your freaking back and spine area. So I'm thanking all y'all for praying for your girl and lift me up in prayer. And even though it's not a serious disease, it's something I'm gonna have to live with for the rest of my life. She says I'm gonna have to take pain medicine to decrease the flare-ups, and it's something I'm just gonna have, basically. And I'm gonna have to keep taking pain pills, and I'm gonna have to keep going to a physical therapist on and off my life, basically. So yeah, that's my update, y'all. I ain't dead. I ain't about to die. I don't have cancer. I don't have AIDS. Okay? Your girl just has a back problem called fibromyalgia, and it hurts like hell all the time. Thank you. I hope I feel better too. I didn't want to even get out of bed today, but I was like, look, I have to tell them something. I ain't talked about it since, it happened. Like, before I went to the doctor, I have to tell y'all something. I can't just leave y'all hanging like a bad episode of Real Housewives of Atlanta or something. My God. What else? Thank you. Pain pills are horrible for addicts. I know. She knows I'm an alcoholic, but the thing about it is she's like, I'm going to put you on the very low risk, addictive pain medicine as possible. I know you have a history of alcoholism. I'm like, well, thanks. Okay, so woohoo. I'm going to have to take some very small doses just of pain medicine. So hopefully it helps. But yeah, that's basically what she told me. I need to always make sure I take my medicine every day to make sure my back doesn't swell up too much. And maybe I can have a normal life. I just miss working out the most. It's not just, I just miss working out. I just miss, going for walks in my neighborhood without having, cramps and spasms. I just miss going to kickboxing classes. I just miss going to Zumba. I just miss being super active like I used to. And it's really gonna suck because it's gonna take longer for me to lose weight, I feel like. I feel like the medicine she's putting me on is probably gonna make me gain more weight. And it's probably gonna be even harder for me to freaking lose weight. So I'm like really pissed off of the fact that I have to take these freaking pills all the time just so I can manage and maintain day to day. But it is what it is. At least I'm not dying. At least I don't have cancer. At least I don't have AIDS and herpes and whatnot. Okay? So yeah, it is what it is, y'all. I'm giving y'all an update and not leaving y'all hanging. I'd rather smoke weed than be addicted to opiates. I might try weed if none of this works. I might try weed, and I'm gonna try CBD oil as well. I'm like, you know what? I'm not gonna totally rely on pills. I'm gonna try me some CBD oil and see if that freaking works. If not, y'all might see me on here next time smoking some ganja. Try Caveat T2. It's an alcohol alternative that helps with pain, depression, and other stuff. Okay. I'm all for the natural stuff, but my doctor, she just thinks that me being on a muscle relaxer or me being on an anti-inflammatory pill would be the best. So I can have a normal functioning life. And I'm 25 and she thinks I should go back to work, but no. Anyway. So yeah, I'm gonna try CBD, I'm gonna try weed. If none of this crap works. So yeah, I have fibromyalgia. That's what you miss. I have fibromyalgia, and it's basically a disease. It's a chronic pain disease that causes muscle tightness, muscle tension, and it makes walking, going to the gym, everyday life very freaking hard. Okay, so that's basically what I have, y'all. That's what it is. And yep, there we go. So yeah, next time I'm gonna do a video. I'm gonna do a gossip video because I hate talking about my health problems. But yeah, I'm not dying. I don't have AIDS. I don't have cancer. I don't have crabs. I don't have gonorrhea. I don't have syphilis. I don't have herpes. I don't have none of that. I have a back disease. I have a spine disease. My neck, my back, my crack is all messed up internally. Okay? Alrighty, y'all. What causes it? What causes it is basically I had a rear end car accident back in 2015, you guys. And that was a really bad accident. It caved in the trunk of my car, and it also made my back really messed up. And I was seeing my chiropractor for a few months after that. And not only did I have that, I also had a slip and fall accident back in 2018, and it messed up my back again. And I saw a chiropractor for months. And then I also went back to work. So she basically thinks it's because my back never healed from my other injuries. And she thinks that my injuries have kind of compiled on each other and made my back to the point that it's so weak that it got that disease. So yeah, that's basically what happened. Come smoke a joint with me. Where do you live? Come smoke a joint with me in Georgia. I need some company. But yeah, the reason why I have this disease is because I never healed from my other injuries. But yep, keep praying for me because I feel like an old lady right now. And even doing this live is exhausting me the hell out. Okay, so I'm going to keep drinking my coffee. And I'm thankful for all the prayers. Thank you for the prayers, the love, the good vibes. And yes, and the suggestions. I love you guys. See you next time. Mwah.